How's it going, everybody? Dr. Valero here, and welcome to the first episode of Recovery Recap. I'm here with one of my patients, Florencia, and she's going to tell us about her journey as an athlete, her struggle with injuries, and then the way that we kind of worked those out for some strategies. So why don't you tell us about your athletic career? How did it all start?
Yeah, absolutely. So I'm a tennis player. Well, I haven't played for a few years now, but I started playing tennis when I was 6 years old, and I played competitively, playing national and international tournaments throughout my childhood and teenage years. I came to the U.S. from Argentina to play Division One tennis, and I did so for 4 years as as I was studying for my undergrad. My first sign of back injury started when I was 17 years old. I had stopped playing for a few months, and then um, I restarted it. And when I restarted it after taking a few months off, it's when my back started hurting. I had severe lower back pain. It was a pain that I had never felt before. Every time I tried to exercise and I would step onto the tennis court, I would just feel this very intense pain that wouldn't let me really move. It got to the point where I couldn't even really bend over. I couldn't sweep. I couldn't really do any of the everyday activities that anybody would do, especially at my age at 17. So that's when I started to go to different doctors and different specialists. And one of the MRIs actually showed that one of my vertebrae is shifted forwards,
Right.
and they diagnosed me with spondylolisthesis.
Now that was L4 or L5?
L5 over S1.
S1, okay, yeah.
L5 over S1.
It's right around where the center of the gravity is, so that's a very common spot for that, yeah.
So they didn't really know what caused it. Some doctors said that it could be genetic because there's a little leg on my vertebra that is missing. Apparently, that's what helps hold it in place.
Yeah, facet. Yeah,
The
it's kind of
facet.
like a little blocker. Yep.
So that's missing. And some doctors said that it could be, I could have been born that way. Some doctors said that it could have broke given a fall.
Sure.
I was always very active in gymnastics, so I did fall and tumble quite often. So I don't know what caused it, but I have been living with and managing back pain since I was 17 years old.
Right.
I remember that I was actually very worried that I couldn't come to the U.S. to play tennis because I was very debilitated. I couldn't step onto the court.
Yeah, I think that's a huge anxiety that a lot of high school athletes have, is that they put so much emphasis on their body has to be this performance machine, and that's all they're worth, and that's a really scary thing to live that way, because there's a level of fear that comes in with that.
I actually never thought about it that way, but absolutely. It was my body was allowing me to do all these things that I had always wanted, and I was right at that point, and I had to perform, and I just wasn't able to do it. So it might have been this anxiety circle that I was trapped in.
Sure.
But that's when I started my journey through different physiotherapists, and physiotherapy helped where I could start walking again and I could start moving freely again. But as soon as I had to do something strenuous, like go on the court and start training a little bit harder, everything would come back. So I was worried, and I had a friend whose uncle was an acupuncturist.
In Argentina or in the United States?
In Argentina. He's at the time the only acupuncturist in my hometown. He is actually from China.
Okay, wow.
And he got his degree in China and moved to Argentina and opened up his practice there. And acupuncture, 20 years ago was very new. Nobody had heard of. It was like this taboo thing. And she said, my friend said, I talked to my uncle about you, and he thinks he can help you.
Wow.
And I said, why not? I have nothing to lose. So I went to see him. And after the first acupuncture treatment, I was bending.
Yeah.
I was bending back and forth, being able to squat. I was like, this is magic.
Do you remember what the acupuncture treatment was like? Like where the needles were, like how aggressive the needle technique was?
I remember, what I remember is that I was treated in a sort of like a community room. There were different people in the same room.
Yeah.
And he was treating different elements.
I
remember going face down, and he did some needles on my lower back.
Yeah.
I remember this one particular needle that he did. I believe it was on my butt. He placed it there, and he said, you're gonna feel something probably going all the way down your toe. And when he hit the spot, my whole leg went up. I remember, I just remember that distinctively because it was so new and different for me. And I'm like, how are you able to hit those spots? But I remember that, and then I remember the needles being long.
Yeah. So it was a bit more of an aggressive needler.
Okay.
Because I was wondering, because sometimes there is more of a gentle needling technique, and there's some more of an aggressive needle technique. Then it seems like usually when people are working around hips, there's usually a bit more of an aggressive needling technique that comes along with it.
Okay.
Yeah.
Hey, it worked. I did 3 treatments with him.
Yep.
And I was able to travel.
Sure.
And I was able to play my entire college career with very little pain, if any. He gave me a few exercises to do, and then
that's fantastic.
Yeah, and then the trainers at my university sort of like help me maintain my back, because sometimes it'll get a little tight. They'll help me with stretches, or they'll give me ice, but nothing really major. I never had a major back injury that prevented me from playing matches. So I've always been a very active person. I did my 4 years of undergrad, and then after that, I just continued exercising. I got into Olympic lifting, and this is probably 5 years after graduating from college. So I was in my 20s, 25, maybe 26. And I had a bad injury that I don't think I ever recovered well. I was doing a deadlift.
Okay.
I was doing a deadlift, and something tore in my back.
Yeah. That's such a common thing that I hear all the time.
Yeah.
Is that like, and then you know what? People then stop deadlifting.
Yeah.
But they don't stop deadlifting. I think we've even talked about this, right? Is that people go like, "Oh, do you deadlift?" And like, "No, I don't deadlift. I hurt my back deadlifting one time." It's like, well, what are you gonna do when you pick something up?
Yeah.
You're gonna do something different, right?
True.
Yeah.
Yeah. So that's where my big injury was. I don't think I ever recovered well. I think I recovered well enough, but I kind of like carried that little bit of pain or tension throughout the years.
Right.
And as I've gotten older and gone into different physical activities, that got worse.
Yeah.
My second bad back injury came a few years later as I was preparing for a marathon. I prepared for the marathon. I trained with pain. I trained with pain, pushed through the pain, because that's the only thing I knew how to do. Push through the pain. Right? And I pushed through the pain, and I was running, 20 miles as part of my marathon training. I was under the care of a physiotherapist and a chiropractor. But 2 weeks before the marathon, I pulled it. I pulled it lifting up a box. And after that,
Was it a heavy box? Just
no,
yeah.
no, no. But I think my back had so much tension built up,
Mm-hmm.
and my back had been compensating to be able to just
It only takes one
run.
spot, right?
That
Only one joint that gets overloaded.
Yeah.
And that's why it doesn't take much. That's what you
Yeah.
don't need a heavy weight to throw the whole thing out of whack.
And that's what I did.
Yeah.
I threw the whole thing out of whack.
Were you? I'm guessing did you go through the marathon or?
So yes.
Yeah.
Which I don't think helped my cause, but
Mm-hmm.
I did run it.
It's tough to say, because some people they start becoming sedentary, and
Okay.
then once like it's kind of like a rolling stone uh, grows no moss, or whatever the saying is, right? But the thing is that once you start getting a little more sedentary, it's harder.
Yeah.
And the thing is that like, was the marathon probably hurting it? Sure. But did the marathon kind of keep you going? Maybe, and then you never grew moss,
Yeah.
you never got lost in
Yeah.
that sedentary lifestyle.
Yeah. So, but now that you bring that up, that sedentary lifestyle, I did go through a few months there where I wasn't doing much because after that marathon, I had back pain. I ran the marathon with an injury.
Mm-hmm.
So then it was time for me to recover from that injury.
Right.
And that's when my journey of finding appropriate care started, right?
Mm-hmm.
Because I was under the care of a chiropractor and a physio
Mm-hmm.
while I got injured training for the marathon. So, I mean, things can happen. But after that marathon, it was really time for me to get into healing my back because I still had that injury.
Sure.
And that's when things got sour.
Mm-hmm.
That's when I started to hit a lot of roadblocks and barriers in the with the objective of finding somebody that understood what I was going through.
Yeah.
I actually found a chiropractor. I've always been big into multidisciplinary teams,
Sure.
right?
Sure.
Like you need, in my mind, it's like you need the eye of a chiropractor and a physio and a massage therapist so they can collaborate and sort of like tackle the object or tackle the injury from different angles, from different perspectives in a holistic way, so to speak. So I did find a practice that had all of that, but the chiropractor injured me more.
Okay.
And then I became very wary and a little scared about where I was going.
Yeah.
So after that incident, what I did is I found a person that had online programs,
Mm-hmm.
and I started to rehab by using one of those programs.
Right.
I was very scared about people manipulating my body. So I said, I've tried physios, I've tried chiropractors, I've tried everything that doctors recommend without really having optimal results.
Mm-hmm.
And let me see this person that seems very competent. Let me see what they have. So I did have an interview and I followed that program, and it helped me recover from my injury.
Mm-hmm.
It helped me recover from my injury. It helped me start to move a little bit better. But I didn't have my life back.
Mm-hmm. Yeah.
Right? I was still in pain. I could walk.
Yeah.
I could move around, but I couldn't run. I couldn't snowboard. I couldn't play tennis. I couldn't hike.
Yeah.
And to me, all of those things were extremely important. So I felt like a big piece of my life was missing.
Mm-hmm.
And that's when I said to myself, let's just keep looking.
Sure.
Keep looking.
Mm-hmm.
There's gotta be somebody close to where you live, because I was listening to podcasts, I was looking at people online, and a lot of people seem very competent, but none of them were close to where I lived. So I said, there's gotta be, somebody that can help you, that is close to home. And that's a little bit where I, in an attempt to find this good care, sort of like stumbled upon your practice.
Yeah. Through Eric.
Through Eric.
Yep.
Yeah, through Eric.
Because, shout out to Eric Moss.
Yeah, shout out to Eric. Doing personal training with Eric, he introduced me to you, because I was very frank, and I said I have all these back issues, and he said, listen, I think we can collaborate and work together with this guy, Eric,
the witch doctor.
The witch doctor. I think he can really provide some guidance as to how to work with you. And that's when we started working together. And I'll say it hasn't. There's been some setbacks, but I think those were necessary setbacks, because when I look at where I was, where I couldn't go for a half-mile walk. I remember distinctively attempting to go for a walk with Matt, with my husband, and coming back home crying because I was in so much pain after walking half mile. And us looking at each other and saying, we're gonna figure this out.
Yeah.
And that's when I started working out with Eric, and Eric introduced me to you, and things just like started to fall into place.
Yeah.
But when I look at, not having so much nerve pain that I couldn't walk half mile, to where I am now, that I have hiked the Grand Canyon.
Yeah, that was when you texted me after you hiked the Grand Canyon, and you're like, I made it through and I feel great.
Yes.
And that was I think that was the best moment in your whole journey.
That was incredible.
Yeah.
That was incredible. And I think that elevated me to a whole different level, right? Confident wise and mind wise.
Yeah.
And it sort of like reinforced all of the work and the effort that we have been putting into this, right? Because I come here and I explain to you what hurts or what bothers me, and I think you have this unique ability to just connect the dots. I think you just are so knowledgeable about the human body, but also you're just so incredible at just connecting the dots, picking up everything that I am laying out, and knowing exactly what to work on or what exercises to give me,
right,
so I could work on at home. And it's through that level of care, that active listening that you do, but also that unique ability that you have to put all of these things together and devise a series of treatments and exercises that we do here at your practice, but I also carry with me at home, that I have been disciplined with. But when I look back, everything has paid off.
Yeah.
Like, I feel that I've got my life back. Just exercise is so important, and it's such a strong bond between my husband and I, and we just enjoy so much doing all of this outdoor stuff. And I felt so limited, and I literally now feel that I have my life back.
And that's your why, is that I get people that they come in and sometimes they're like, oh, like this bothers me, but and then they almost think it's not important to tell me why it bothers them, you know. And the thing is that like you and your husband, I mean, you guys are so active and you do so many things together. It's such an important part of your relationship that like it's an integral part of your relationship. You know, it would change if you couldn't do those things, and you don't want to lose that. You know,
absolutely.
And I think when I hear that why, then I go, all right, let's tap into this why. You know, let's figure out like this is, because I think you can go to some people and they'll, like, maybe you trust them, you know, maybe you have gained, like, they've earned your trust and they tell you to do something and you're like, all right, I'll do it. Why? Well, they said it, you know. And but it's not aimed at the why. You know, when I give somebody an exercise, I want you to like visualize, like, you can't do this right now, right? You can't pick up your grandkids, you can't go hike the Grand Canyon like you want to. And when you get a rehabilitation plan, right? Everything, if there's something in there that someone goes, I don't get, what does this have to do with me wanting to hike the Grand Canyon? I better have a good answer. If I don't have a good why as to how it helps your why, I'm taking it out. You know, it's not important.
And I feel that's been very helpful, actually, because when I was talking about like the active listening that you do, it's like I feel that you get it, like you get not just the pain, but you get how it's impacting me. So I feel like, you know, you understanding the reason, it, I don't know, like, it helps me trust you more.
He
gets it, he understands me, and we're sort of like in this together, sort of thing, right? So I don't know, it creates it on my end, it creates some sort of accountability. Like, he gets it, he's doing everything that he needs to do, and I need to hold my part of the deal.
I hold my patients to a high standard.
And you know, I gotta maintain my exercises, because next time I go see him, he needs to see that the work that he's been doing with me, I'm working on it, and it's getting better. And I want to come in and tell you, you know, how things are going and progressing. And sometimes, you know, I might have a setback, but I think overall,
you're still living your life, you know.
I'm living my life.
Setbacks are part of life.
That's right.
You know,
that's right. And now I know that, you know, if I do have a setback, which I haven't had a setback in I don't know how long. I was getting injured every 3 months, and I don't remember when my last setback was. Actually, it's probably a few. Actually, I do remember now. It was a few months ago, and the reason being, it's because I stopped exercising. I stopped doing some of the my workout regime. I got busy, and as soon as I resumed that, along with, you know, your care, I was like right back to where I was before.
And you know what's great about that is that you, every time you have a setback, you gain a little piece of knowledge, like a little treasure of like, there's something you didn't know before. And now you can integrate it into like your model of how your body works and your lifestyle.
No, absolutely. And not only that, but I became so aware of the importance of movement. Because I know that if I don't move, if I don't do my exercises, and if I don't work out, I am going to have a setback. So it's like, I remember you telling me, you know, it's going to be great when you see and when you understand that movement is your therapy. Well, I'm there. I think I finally understood that movement is my therapy. And I think it's important because I prioritize it now.
I see it every time you come in. You're like, I'm pretty good. I'm pretty good, you know? Like, it's not that bad right now, you know? I think this has been like my slogan for the past few weeks, but I've really been telling a lot of people, I'm like, my main job is to get you out of your own way. Is that everyone hears the this catchphrase, this soundbite, the body heals itself. And the thing is that's 100% true. The problem is that sometimes people don't let their body heal themselves. And your body's trying to adapt to the types of activities that you do, right? And I always tell people you don't have time to waste at the gym. Yeah. Like I think people that get hurt but go to the gym, like that's I feel like I bring up Rubik's Cubes all the time. In my other podcast, I bring up Rubik's Cube all the time. But like that's kind of like you have a green square on a red field and a red square in a green field. It's like you get injured and you waste time at the gym. It's like, no, switch that spot here, put it here, put this piece here, right? You need to make sure that when you're at the gym, like it's not like mindless. It's I'm working out because I have an activity I want to do that I'm not conditioned for. My body's not adapted to, right? And when you prioritize your exercises like that, you prioritize your workout like that, you're working out for a reason. Yeah. And you don't get injured because of your workouts.
Yep. And I think it makes you that much more likely to maintain that routine because you have a why, you have a reason, you're motivated.
Yeah.
Something else that's changed with the way I work out is I used to work out and I used to push through the pain and I used to push the discomfort, and it's part of your body's never going to feel good or right, and you've got to just push through. But I now look at things a little bit differently. And I'm more mindful of how my body is feeling. And I think I've gained knowledge as to, well, what's bothering me? And I've learned how to take that tension out right then and there.
Yeah.
And now that, and I do my back because I primarily, have back issues. So I've learned when my back feels tense right in this spot. And I've learned through you different movements that I can do to get rid of that tension. So now if that tension is not there, I can work out without pain.
Right.
And working out without that pain and that tension will ensure that my muscles are loading properly.
Yeah.
And that the exercise is having the intended effect.
Yes.
Whereas before, I was making myself more prone to injury. Now, I'm making myself, I think, more functional.
Yeah. Oh, yeah. Well, because I mean, when you, this is why warm-ups, some people poo-poo warm-ups, and some people overdo warm-ups, but they're just not efficient or effective. Is I think of warm-ups as you have a certain requirement for the range of motion that each of your joints need to go through in order to perform the task. You might say if you have all of those range of motions and the blood flow is good, like you are good to go, because you're not going to get injured as with normal loads, right? And like when you were saying about your back tension and how you like one of my favorite things for my patients to come back to me and tell me is that they go, I had back tension and then I did something about it. I'm like, good, right? Like, yes, good, because so many people have back tension and they go, let me wait till the next time I go back to my guy or something, my physical therapist or whatever it is, right? And it's like, that's a failure on their part then, because they should be giving you strategies to get rid of that, right? One of my favorite things to tell patients is when they are trying to figure out tensions, right? They're trying to figure out like this muscle's tense. Like I always tell them, like you're holding a weight in your arm and you poke your bicep and go, this is tense. That's not a dysfunction. I think one of the biggest things that people, like an aha moment, is when I say lay on the ground.
Yeah.
Completely relax.
Yeah.
And you're not going to fall through the ground.
Yeah.
So something on your body thinks you're going to fall through the ground. And that's what's wrong. Not the things that are holding you up. That's what's wrong. And then instead of taking out some tension how do you know if you need to take it out? You start to work on learning what that tension needs to tell you. It needs the eccentric load better. It doesn't trust that it can go onto a stretch position.
That's a big one with me. Yeah.
Yeah, right?
Yeah. No, and it's really awesome because I feel tension sometimes, not just when I work out, but when I wake up, or I've got to, and you wake up and you've got to move and you've got to do your everyday things. And if you know how to take the tension out, how to recalibrate and stabilize, right, your spine, then you're good to go. Like, you don't really have to think about your back when you're doing your everyday things. So
you're saying all my favorite things. when people don't have to think about something, like when my patients that are runners go, like, what should I be thinking about when I'm running? Should I be hitting the side of my foot more than my It's like you shouldn't need to think about this. You should be able to relax in your mind when you run and be free, If there's something wrong with your gait, you can't fix it while you're running, As long as you have the proper ranges of motions and you're properly warmed up, you just go.
True.
That's what a dog does, right? A dog doesn't go like, oh, my abductor's a little, they just go.
Yeah. No, and and it really is fantastic because, like, I keep on living my life and I keep on doing the things that I want to do with that I'm equipped with more knowledge. I feel like I can pretty much do everything that I want to do.
That's great.
Yeah. No. Yeah. I remember, like, when I was going through these tough times and trying to find good care after injuries, and just feeling that uncertainty of, am I going to be able to go back into hiking? Am I going to be able to snowboard? Am I going to be able to scuba dive? But those are really important things for me, right? And I kept looking online, searching online for answers, and I kept reading these amazing testimonials of people saying, oh yeah, I did this and this method and it worked wonders, and I'm pain-free and I can do everything that I want to do. And I just kept thinking to myself, like, I want to be that person. I want to be able to give that testimonial. I want to just get to that other side and said, hey, I did this and it worked wonders, and now I'm able to do everything that I want to do. And fast forward 2 years later, since I started with all of this, maybe less with you, I can honestly and generally say that I've jumped to the other side, where I've gone through this rehab process and it's literally giving me my life back. I'm able to do everything that I want to do. So thank you for that.
That makes me feel amazing, because to be honest, like, that is what gets me up in the morning, to hear people tell me that their life is back. Because it's something that really burdens me. It really does burden me to have the knowledge of, oh man, this person is not living their life to their fullest. And I have something inside my head, that I can help this person. And it feels so good for somebody to let me help them, because that's really what I feel is one of the most frustrating things, is that like they always say, like, in the Bible, they say, don't throw your pearls before swine. Is that, like, you don't want to throw your wisdom out at people that are not going to appreciate it. But I feel like when somebody, I really just, I have this craving to help somebody. When somebody tells me, like, oh yeah, that's why my shirt on my back, I don't know if you guys can see it, but it says, do you want your back to feel better? And to be honest, like, one of my patients, like, told me that was like my catchphrase, because, like, it gets that conversation started. Like, yeah, I
Sure.
do.
Yeah.
You
sure.
know? And if we could break down that barrier of the I have the information and you need it,
Yeah.
right? And I can just start to give it to you.
Yeah.
You don't have to keep coming to me even.
Yeah.
It's just now you live your life and
Yeah.
you have that understanding of how your body works better.
Yeah. Yeah. And I think that's a very important point, right? Being able to build that trust in the relationship, where you're right, because as a patient, you've got to let your guard down and say, I'm going to trust the process.
Yeah.
And I'm going to follow this advice.
Yeah.
Right. So I think it does take a level of trust in the doctor patient relationship. But I think some of the things that have helped me trust you, your knowledge about the human body is obvious, right? I mean, it's incredible. But it wasn't that. That sort of like made me think that okay, this guy knows the body, and he's got the knowledge, right? But I think it's different having the knowledge with being able to connect and treat somebody.
Yeah.
And one of the things that I think helped me trust you is it's just you're very open to other ideas. You don't like pigeonhole your beliefs.
Yeah.
Right. And the fact that a lot of times you were able to think outside the box, or entertain an idea that I might bring in from traditional medicine, and not condemn it and work with it, is what really made me think, I think we can get somewhere here.
Yeah.
Right. I don't know. I think that there's a lot can be lost when we're not willing to listen to other ideas or other perspectives, and I found that in you, and that was really important to me, because I have gone through other stuff, but by being able to entertain some of the things, like, hey, I remember coming in and asking you, what do you think about cortisone shots? And
most people think I'm going to poo-poo them real quick.
Yeah, and you gave a really smart and well articulate answer with good arguments that I was like, oh, well, that makes sense.
Yeah.
Maybe I could try that, and let's see how it continues, and things like that.
Yeah.
That you're some things you agree, some things you don't agree, but just having that conversation and that openness.
Yeah.
Of, hey, let's incorporate where we think we can incorporate, and if we don't think we can incorporate something, I'll let you know, and I'll let you know why.
Yeah.
And make sure you understand why. And it's that working together.
Yeah.
That I found very helpful, and that really made me trust you.
Yeah, I think the way that just studying a lot of different, I studied Eastern medicine obviously with my degree, but I continue to perpetually study more Western medicine in different facets, pharmacology, histology, all these different things, right? And I think one of the biggest takeaways I've recently have gained from that just the pursuit of knowledge of that is to understand that medicine is a tool, right? And I think when you see a tool get abused, it's very easy to condemn the tool, you know, right? Cortisone is it's something I find gets abused so often. People go, oh, I'm going for my every 6 months I go to get my cortisone shot, right? And that's obvious abuse, right? That's not how it's supposed to be meant. And then I had one patient that very early on he asked me my opinion on it, and I said, you know what? You're not moving as much right now. Your blood flow is not good right now. Is the cortisone shot going to be like something that is healthy? Like you should just keep doing it? No, but like, is that going to get you to move? Like, yeah. And he tried it, and I think I even told you about this patient, right? And I told him, like, when you get the cortisone shot, plan to progress your movement up, right? Start moving more and more and more. And I've seen that patient for years, right? And he kept coming back. I'm like, he's like, but like the main issue he first came for, like, was gone, right?
Yeah.
Because, and the thing is that he got the worst diagnosis from, they were like, you need surgery upon surgery, right? And he went with the cortisone shot because he didn't want surgery. And he is able to live a really like full life where he's able to work out and he's able to do all of his yard work. He's very physical guy, and like he's the testimony right there for how to use medicine properly.
Yeah.
You know, like, because it can help.
That's very valuable. I think it's very valuable what you just said, right? Like using medicine as a tool, but knowing how to use that tool.
Yes.
And I think that's what you bring. Like you know how to use that tool.
Yeah.
And you know how to combine, or how to, maybe the appropriate use of traditional medicine and complement or enhance that with the Eastern medicine approach.
Yeah.
So I think that's something very unique in your practice.
Well, I remember this was a big buzzword toward the end of my my years in grad school, but was integration, right? And there was a few of my teachers. One that comes to mind is this guy Jeremy Pulsifer, right? And I remember his class was so interesting because it was one of the first times in school, because obviously I went to an Eastern school, right? So all Eastern philosophy on medicine, right? And the thing is that it was incredibly heavy on Western medicine. And the thing is that, like, I would say that those schools are probably leans more 60% Western medicine when they're taught. You know, you have anatomy, physiology, pathology, pharmacology, all these different things, right? But then you're taught all these Eastern philosophies, and you go, how do those two mix? You know, and I believe that I don't believe in like truth being relative. I don't believe in you could think two contradictory things and they both could be true at the same time. And I think there's an ultimate truth out there. And I think when you're a truth seeker like that, you know, like that's why I think that professor that I had, he was a truth seeker, and he was tuned in to, like, how can this be true and the Western side be true as well. And, you know, I can't accept everything because neither of those are perfect systems, right? The Western medicine's not perfect, Eastern medicine's not perfect, but when two things be married together from the Eastern and Western, it's like, wow, you really know this is true. This piece of knowledge went through the Eastern lens and through the Western lens, and it comes out and it's real. And you see stuff like that, and that is gold right there.
Yeah. I think that's a great approach. I think that's probably how we're gonna really help people feel better. trying to, I mean, you have I don't, but you have the knowledge to scrutinize all of that and test
Sure.
a lot
Yeah.
of that stuff, right? With patients. But I do think so. Like there's no point in vilifying anything.
Yeah.
Especially when it's helped so many people.
Mm-hmm.
So keeping that open mind as to, well, what can we get from here? What can we get from there? How can we make them complement each other to truly deliver quality care?
Yeah.
And I found that here, actually. I found that here. So I think that's the reason why, I'm able to do everything that I can do now.
Oh, that's so great.
Yeah.
So I wanted to end up with one question. Out of all the modalities that I use,
Ooh.
right, which one was your favorite and why?
So depending on how I look at things, right?
Mm-hmm.
I love the acupuncture.
Mm-hmm.
Because I get to relax.
Yeah. Mm-hmm.
I love the cupping because
Yeah.
I get to relax.
Yep.
I think ultimately the movement exercises are what have helped myself understand my body and what my body needs better.
Yeah.
So I do have to do more work.
Yes. Yeah.
I think the combination of everything, it truly delivers the final product. But the movement exercises have helped me understand my body dynamics and how to give my body what it needs, whether it is releasing tension, stabilizing. Yeah, I would have to say that all of those movement exercises have been eye opening and ultimately, I think the biggest uh, building blocks in
See,
the
that's so
journey.
surprising, but I love to hear that.
Yeah.
Because they're my favorite. That's my favorite modality.
Okay.
Like, because it makes me think when I almost feel like it's like play. Like there's a game and we got to solve this thing. Is that like, and the thing is that like it's true. Is that like I'm looking at the system just like you are.
Yeah.
And like we're trying to figure out what's wrong, and try to figure out how to make it right. And that's my favorite modality.
Yeah.
And I mean, the thing is that there's a reason why I do cupping. There's a reason why I do acupuncture. There's a reason why I do like the instrument assisted work. And you're saying it's because it helps you relax. And relaxation is a huge start to things. You can't get something to relax. I mean, I always tell people, you got to punch out like this. Yeah. This is the worst place to start your punch. Yeah. You need to be back in the relaxed position before you go and execute your punch. Yeah. So getting people to relax is such an important start, but it's the start. Yeah. Yeah. We gotta we gotta embark on the movement journey.
True. And something else about cupping and acupuncture, another big one for me is that like you said, it's a great starting point, but all of that stuff is done by somebody else.
Yes. Mm-hmm.
So if ultimately, I want to be able to help myself, I want my body to know how it feels to release tension.
Yes.
Right?
Yeah.
As opposed of somebody else doing it for me.
Mm-hmm.
Like I can do this and my body feels it and says, oh, okay, that's what I need to do to release that tension, to gain range of motion, and in the future I'm going to be less likely to tense up when something like this happens, right? So it's more in my control, and that's another reason why I like them so much.
Well, that's why I always tell my patients, I'm like, I'm looking to make me irrelevant to you, right? And I'm not that I don't want a relationship, right? Is that I don't want anybody to become dependent. And I think that it's a bad business model, right? Obviously, that's a terrible business model. But ultimately, I like to get patients to the point where like they're like, you see this therapy I did, this manual therapy. This manual therapy fundamentally was trying to bring the tissue back to a physiological state. Not enough blood flow, the tissue wasn't extensible enough, right? But you could do that, and when people see that they can do it and that I'm telling them how to do it, right? There's almost like a baton toss off at that point, where I tell some people, I'm like, you've graduated.
Yeah.
Here's a baton toss, you keep it going. If you find somewhere in your journey that you also have another time where you don't understand how your body works and you're starting to come through another wall, come back. Yeah. And I hope you do, and I hope you send other people along too. But that's what I really want for my patients, is that they become self-sufficient and they can do it on their own.
Yeah.
But there's you keep coming back because there's so much more to learn. You know what I mean?
Yes, there is.
You have the best Turkish getup. I'll put this on record right now. The best Turkish getup I've ever seen.
Yes.
You have worked so hard on that, and that's one of those things.
I have, because it didn't start that way.
Yeah. That's one of those things where it's just, you don't have the heaviest Turkish getup I've ever seen, but I would put your Turkish getup, which is just so precise and efficient.
Good.
I would put up against any of those any day, because that's where you can keep progressing on and learn more about how to make your body as optimal as possible.
Now that makes me feel really good, because I do put work into that. So
yeah.
And I'm excited because I'm thinking about 10, 20, 30, 40 years on the road.
Yep.
And how to keep my body going. And
that's how to do it right there. Build up resilience.
I feel like I'm building that. So I'm excited. I'm grateful for that, really.
Excellent. All right. Well, thank you so much for coming today.
Thank you for having me.
Of course. This is such a great story. I love hearing a good story like this.
Thank you.
Thanks for sharing your story.
You're welcome.
All right. Well, tune in next time for episode 2 on the recovery recap. All right. Everyone have a good evening.